in the country named after an African American. The National Association of Black Journalists is 45 years old. So we were born after Matthew Walker actually started in the Nashville, Middle Tennessee area. And Matthew Walker last year served over 17,000 patients. So we're excited to be here today to have this conversation with you. And today's conversation will be moderated by Jason Luntz, who is a former president of the Nashville chapter of NABJ. He is also a media strategist and the founder of Your Voice, a small business that utilizes the creation of original content, multimedia projects, website design, and social networks to help organizations build an online presence. He's also an adjunct professor at Tennessee State University, where he teaches courses in entrepreneurship, public speaking, and online media. So I will turn it over to Jason, who will be moderating today's conversation and introducing our panelists. Jason?
Good morning. Thank you, Founder Weaver, for that great introduction. I appreciate it. I'm excited to be here today. Good morning to everyone that's tuning in. We really appreciate you. The Black Male Media Project is a national initiative to help change the narrative around the lives and images of Black men in news and society. So right now, throughout the country, our various chapters are holding workshops and Zooms just like this. Today, we're going to be addressing the physical and mental health of Black men during the COVID-19 pandemic and the aftermath of the death of George Floyd's murder, or death, excuse me. I'm really excited today. We have a great panel of three Black men from Matthew Walker. So I want to go ahead and introduce them so we can get started and jump right in. First up, I have Roy Young Jr. He's a seasoned IT professional across multiple platforms and environments. He's a U.S. Navy veteran. Thank you for your service. He's a TSU graduate, and he has 20 years experience in higher education, state government, corporate business management, and accounting. I have Gregory Shelton, who was actually born and raised here in Nashville. He attended University of Tennessee at Chattanooga. He's very passionate about helping Black people, and right now it's mainly through healthcare services and some of his technology. And finally, we have Dr. Kevin Dennis, who is a 21-year resident of the Middle Tennessee area. He has a double doctorate graduate of Florida A&M Universities of College of Pharmacy and Meharry Medical College. He's a mentor and advocate for Black males in medicine, and he supports the mission of historically Black colleges and universities financially and emotionally. Thank you, gentlemen. We're excited to be here.
Thank you for having.
Thank you. We appreciate your time. And what we want to do is, before we jump right in, I want to start with you, Dr. Dennis. And maybe you can just give us a brief understanding of what exactly COVID-19 is in some layman's terms.
Sure. COVID-19 is actually called the coronavirus of 2019. So the short and skinny on COVID is actually the terminology. COVID-19 stands for the coronavirus disease of 2019. The coronavirus itself is actually a disease that has been around for many, many years. The coronavirus, however, this particular one is very new and different. We've never experienced this particular virus globally, and this is what's bringing on quite a bit of anxiety. Right now, we're dealing with what's called the perfect storm. The perfect storm are elements that actually have affected Middle Tennessee, everything starting from the tornadoes that began on March 3rd, 2020, that actually ripped through 100 miles through Middle Tennessee region, killing 25 people, as well as leaving people homeless, without jobs. And then right after that, on just 2 days later, we had our first case of COVID-19 in Tennessee. So the coronavirus actually occurred 2 days after the tornadoes ripped through Middle Tennessee, killed people, took away their homes, and left people homeless. So coronavirus, COVID-19, has been what we consider to be a second hit in this particular area in Nashville, but also globally. We are trying to deal with how the impact of social isolation and dealing with the pandemic globally. What is our approach to healthcare for people in this particular region, but also globally? In addition to that, we had a third hit which we consider to be the deaths of Ahmaud Arbery, Breonna
Mhm.
Taylor. We also had an incident to occur in a park by Miss Amy Cooper, who accused a Harvard graduate of approaching her and bringing harm to her in a park, which did not really occur. And then we also have the actual death of Mr. George Floyd following that. So we have three elements of what we call the perfect storm that is occurring. And nationally and globally, we find that protests are occurring, and mentally and physically, and many patients are concerned with anger, anxiety, depression. We're seeing also an increase in domestic violence. I'm gonna say that again, along with alcoholism and drug abuse. So hopefully this conversation today, and I really appreciate the opportunity to work with you all and be with you today, and probably come to some ideas, how do we approach these problems.
That's great. Great explanation. And you're right. It is interesting to see that we had these things happen one after another. And it really has hit our community hard. One question I have, and I guess I can open this up to whoever wants to grab this. Why does it seem that Black men, or in fact, the whole Black community as a whole, are more affected by COVID-19 than other communities?
One of the problems with communities and African American communities is how we live and what we call the overall socio-economic impact of what has occurred for generations. Overall, African Americans live closer to one another. They have less access to healthcare and proper healthcare. Also, sometimes have less access to even proper health. You don't find gyms in many of these communities. You don't find the capabilities to access proper stores or grocery stores in these communities. Also, there's generational living. Sometimes you have grandparents, great-grandparents, and children and grandchildren all living within the same confines. And with a virus like COVID, and you have social distancing that is required in this process, also, you see the changes going along with working in environments. It's difficult to actually separate and isolate and protect and provide those kinds of things necessary for COVID not to have its impact.
Now, go ahead.
No, I was saying, I think that just piggybacking on what Dr. Dennis is saying, a lot of it is just kind of amplifying a lot of things that were already a problem for us. You know, we're already a poverty-stricken communities. We're right on top of each other, and these also play a part into our health. So when you're talking about, introducing something else that nobody really understands right now, it makes it 10 times harder to just really, get a grasp of it and control it how we need to.
Are you seeing, what would you say majority of the patients that come to your location are African American?
Yes, our population is mostly African American, but it's mostly just minority. Period. We see a lot of Hispanic patients as well, and other ethnicities.
Do you have a procedure for people that come in that may seem to have or be affected by COVID-19?
Yes, we've been following the guidelines that have been, kind of submitted down from CDC as far as just a triage or, a basic preliminary screening prior to them even coming into the clinic. And we've been following that very closely. It's kind of, we're supposed to be opening up a little bit more with the phases, but we've definitely been taking precaution and following the guidelines that we have in place.
Oh, and Roy, I have a question. And you work with technology. Have you found any ways that we can use technology to get some of the information that Dr. Dennis was explaining out to African Americans?
Well, let me say, this is one way that we're getting information out to the public by doing what we're doing, and we're doing it in a platform where we're not spreading the disease between each other, or possibly spread the disease between each other. We're following business and universities and metro schools, their examples by doing these meetings like this, and encouraging virtual meetings. We also, and just using the platforms that are available to us, like, Teams, Zoom, Skype, things of that nature. I also like to say that, the internet is full of information. I mean, there's nothing out there that, you can't search and search on and find out a little bit more information on. Is you just sit down, put it in, pull it up, read it, study it, and just learn. Just learn.
That's great. One thing I was thinking about too when we were working towards having this event today, and maybe Dr. Dennis, you can jump on this one first. What are some of the craziest conspiracy theories you've heard about COVID-19, and how some ways we can help rid our community of these rumors?
Yes.
Wow.
Well, unfortunately, rumors about medicine and care of medicine and where things come from have been around for eons. And so the conspiracy theories as far as where things come from, in particular COVID-19, everything from it started from, let's say, started from a certain part of the country, therefore it's associated with only a certain race of people, that this actually was created by the federal government, that this virus was something that was created in the laboratory and it was released for the purpose of actually affecting African-American people. This is something that's actually going on in conversation, that it was created to destroy and kill African Americans. And unfortunately, the science does not lead to that theory being correct. But I can say that because of our comorbidities, because of our health, whether it be diabetes, whether it be obesity, whether it be hypertension, we are affected negatively or impacted heavily by the coronavirus because of our health. And this is why it's so important that we see our clinicians, we see our providers, get the proper care, treatment, so that we can attack these comorbidities, those things that are chronically ailing the African American community, so that we can better be prepared for those things that come up. The coronavirus is not leaving, it's not going away. Even though there may be a vaccine, there may be other outbursts in the future. We need to do things better today as a people, as Black males. We need to take control of our health and do those things necessary so that we can be there for our families.
Mm-hmm. Gregory, have you noticed any of the patients that have come to Matthew Walker that have these fears of some of these conspiracies?
Not too much. I know that there is a lot of fear that surrounds it, and that kind of is what kind of propels conspiracy theories or just distrust with certain groups. And don't get me wrong, I'm definitely a conspiracy theorist. I love it. I like the entire idea. Like one of my favorite movies is V for Vendetta. Like seriously, so I'm all there for it, but I don't always buy into everything and the credit of it. I know one of the bigger ones that I had been seeing is about the microchipping. You know, they've already been doing that over in Sweden, but I don't really feel like, you know, that's coming to America so quick, because we're protesting coronavirus, you know, or being locked down on coronavirus. So if people aren't wanting to do that, then I doubt that there's any type of way that we're going to be getting to microchipping or something like that very soon. But there are some things that, you know, are very true. There are events that have happened in the past, especially to minorities or people of color, Black, you know, that have we've been on the short end of we've gotten the short end of the stick on a lot of things, you know, as far as like testing and just intentional malpractice, you know, as far as how we're treated. So it's definitely a reason for those thoughts sometimes. But for me, I try not to live in fear and, you know, just kind of preach positivity for our people.
No, that's great. That's great. I think that's a very positive way to look at it. Being aware that obviously this is affecting us differently than other communities, but also focusing on what the facts are, because a lot of these conspiracy theories can definitely throw off the way that we're trying to explain this issue to people. Roy, now I see that you're at home in the home office, so you're quarantining. Now I'm wondering, as a Black man, and maybe you can advise some of the men and women that are watching this today, what are some ways that you're trying to find yourself staying active at home while you've been quarantining?
Well, let me just say that my routine has been thrown off with the, you know, the pandemic and everything, because normally I'm out of the house very early in the morning, going to the gym, showering, then showing up for work. So not having a gym in the house, and having to depend on push-ups and sit-ups and things of that nature, I have not been my best self in that aspect. So it hasn't been good for me. It's like COVID-19 has probably put 19 to 20 pounds on me. So so that's been my challenge. The only exercise I might get is, when I pull the lawnmower out and don't ride and push versus riding. But that's about it. But I've got to get better.
Yes. We were talking about it offline too. I mean, I definitely have gained 20 pounds during this quarantine. It's amazing. I'm like, everything is tight and nothing fits.
Yeah.
But Dr. Dennis, do you have any tips that you give to your patients on staying active?
Yes. I always talk about that, this COVID situation, we call it the COVID situation, when you're putting on weight, especially for our diabetics and patients that are hypertensive. Often they're affected negatively by that increase of weight, where it affects their blood sugar levels. It affects some other parts of what we call the things that we actually follow in their care. And in particular, I always encourage walking. Walking is a huge exercise. Walking in your community, walking around the neighborhood if you can. Walking is very, very good. My wife actually forces me to walk every night. She forces me. She's like, we got to get out of the house. Let's go walk around the neighborhood. As a matter of fact, Tony Dungy and his wife, Tony Dungy, the NFL prior head coach and analyst, he and his wife have been walking like that as a part of their mental stress for years. They actually walk every night together as a couple. They say they discuss their children, they discuss their lives. They say that's the only private time that they actually have, where there's no telephone involved, where they can really communicate. But at the same time, it's great for your health as well. So this is something you really do for yourselves. Walking is a great exercise to start with. And also eating healthy. 80% of weight loss is actually associated with what the intake is, what we eat. So we want to eat healthier foods, and actually weight loss will come with just eating alone, even without exercise. Proper eating.
Okay. So so proper eating is important. Yeah, because I have to admit, I've been chomping on these Pringles a lot. And these Snickers. I need that comfort.
I can understand.
It's so easy to do it though. It's what we have in the house,
Okay. Yeah, it's definitely, just having it in the house. And during the quarantine, I kept calling Kroger and Publix the club, because that was the only place we could go run to the store. And I've just found myself, I just kept buying Pringles. I was like, I never ate Pringles as much in my life, but they are help me gain this weight. Now, another question I want to ask, I don't know if any of you brothers have children, but I'm sure you have children in your family. And as Father's Day is approaching, a lot of men who have children are worried about how this COVID-19 can affect their children physically and mentally. I know friends of mine that have children saying it's really hard, that their kids are really stuck in the house, and they have a social distance. So they can't play with friends. They're not going to school. They're just in the house. Do you have any tips for parents on handling this pandemic with their kids mentally and physically?
I know with my son in particular, he's 16 years of age. He's going to become a senior this year. And he's very what I call social media attached. So what that means is he loves the internet. He loves those things that come along with it, social media. So we've actually put together a program for him where he's reading more. And if he's on social media, he's doing some academic things as well on social media, searching for proper things. We're actually giving him Black history projects. Like, there's a lot of history that is not known, that's not taught in school systems. So we're teaching him about the Tulsa Massacre. We're teaching him about different things that happened in Black history. And he's actually learning while he's using his search browser. We also encourage him to get outside, do some push-ups, sit-ups, and also do some sprinting in front of our home. That way he's actually getting some physical as well. He's very active in sports, and it's actually something that we've encouraged for him. But we take an educational approach. We take a fun approach. Also, chores are good as well, providing a chore schedule for him. So we put down a list of things that he can actually perform in the home actually for financial benefit as well.
Cool. I have a daughter in the home, and she has several friends. Of course, most of her friends are of the other persuasion, so they like to do sleep-ins, and my daughter gets invited on a regular. So about a month or so ago, she approached me wanting to participate, and I didn't have to say no, because all I did was have her read an article that I had come across from one of my close friends' wife, who posted it on Facebook, and it basically went through the scenarios where you can be in a public place and walk down an aisle and actually contract the COVID and then take it home to your parents. It gave all kind of scenarios. So she read it from the beginning to end, and I proceeded to say, I said, well, if you can promise me that you can go over there, have a great time, come back home and not expose your father, who is more susceptible to get sick, then fine. She said, I'm not going.
So that was the greatest way.
Exactly.
That was a great way to stop her.
Yeah.
What about
exactly.
you, Greg? Do you have any children in your family, or?
No children of my own. I have nephews and a niece, and some little cousins, that I still try to be pretty active with when I can. The main thing that I do is something kind of like how Dr. Dennis does. I give them small little projects here and there. Try to get them to be creative in the way that they're comfortable being creative. So a lot of them, like Dr. Dennis was saying again, are really connected to social media or just to their phone in general or technology. They want to play the game all the time. And I have a nephew, and he's going into his senior year as well. And I tell him, I say, hey, you like playing these games so much, why don't you get on YouTube, or why don't you get on the internet and look this stuff up and see how you can actually make them, or even just going to get a canvas from the art store and some paint, and say, hey, like, let's see if we can paint something, let's look at a coding class online, something that's going to be beneficial for you. You're not going to, just be sitting around wasting your time. But I am a pretty active and outdoor person, so I do still try to get them out of the house as well. I might hit a trail, but we're still, being cautious and keeping our distance from people as much as possible when we're doing that. So it's definitely ways to do it, and I think it's healthy for people not to just be inside all the time. The sun is great for us. It's energy, man. So
I think those are great tips. I love the idea of this being a perfect time for children to actually use this to focus on, to be able to focus on, sorry about that, guys. To be able to Zoom technical difficulties with Zoom sometimes. Everybody in the world is using it right now at this moment, so I understand.
Yeah.
I think this is a great opportunity for children and even for adults to use some of this free time to practice and learn things that they've always been interested in. But mentally, though, I was reading some stuff, and maybe one of you can jump on this. It's like, I saw all this pressure when this first happened. They were like, all these memes. If you've always wanted to start that business or write that book or do that hobby, now that you're home, this is the perfect time to do it. But then other people felt like you don't have to put pressure on yourself to feel like this is the opportunity to change your life. Like, it's okay to just be in the moment and realize that this is a global pandemic. Do you guys have anything to say about that mentally? Like, should we be using this time to have to do something productive, or is it okay just to take it all in?
Well, I think that mentally, it's always great to find something to use your brain for, to develop a new skill. But again, it should not be forced. If it's something you've been wanting to read, or a favorite book you've wanted to read and haven't had time to read that book, I think we should have the opportunity to use our brain skills in such a way that it brings something positive to our lives, so for our mental health, because we don't want to become depressed. It depends on our personalities too as well. Some of us are introverts, some of us are extroverts. So we have to find those things that we feel can match our personality styles, so that we don't go crazy out here, because really it's not normal to be in the house all the time. It's not normal. This is our normal process, but it will not last forever. And that's one thing I want to pass to everyone, that this process will not last forever. This too shall pass. And so
Yes,
we have
Lord.
patience in the process. We will get through this.
Oh, that's great. That's great. I love that attitude, and that's a great way for people to look at it. It's not going to last forever. Now, we also want to talk a little bit about, and you mentioned it with this perfect storm of things that have happened to us in our community. So we know right now, with the murder of the people you mentioned and the murder of George Floyd, or the death of George Floyd, has really caused a lot of civil unrest throughout our nation. People are angry. People want to express themselves through protests and rallies. How can people participate and still protect themselves from the COVID-19? Is that possible? Should we be social distancing and we really shouldn't be out in the streets protesting, or can we make that work?
Well, what I expect and what the scientists are expecting is an uptick in what we call coronavirus cases. Protesting is very important. It's part of our culture, it's part of America to do this. However, in this particular season with the coronavirus, it needs to be done in such a way that we protect ourselves and others from contracting this disease that we don't know much about. The masks that are being worn, I'm seeing the protests, and it seems as though that many have taken an approach to wear the mask and cover and protect themselves. However, even in that, there will be an uptick in virus cases. I believe that if we sit in the home, we don't express ourselves, then it too is not a good thing to do. If you feel like you need to protest, you need to get your voice and be heard, this needs to be done. So I think there has to be a common balance between the two things. There must be a balance. And so I'm liking what I'm seeing, that many, many protesters are wearing masks and protective things.
That's great. Gregory or Roy, do you guys have any comments about the protests and COVID?
Well, I like to say I'm not going anywhere without a mask at this time. I just feel like, I don't want to put my family at risk. My parents are also here in Nashville. I'd like to drop by every now and then. My mother, she's very adamant about not wearing a mask when I show up. So with knowing her habits and what she's not willing to do, that just motivates me more to do the right thing. So I'm not going out without a mask. I'm just not going to do it, especially in public. I'm riding in the car by myself. I'm not going to have a mask on. But as soon as I get out and I'm coming in contact with other people. I'm putting a mask on.
Now, we actually had somebody who's watching at home had a question. They were wondering, how can we connect with our elders since they're not as comfortable with technology right now?
So I kind of typed up a short answer. I'm not, when you say not as comfortable with technology, just be creative, play to the level of their comfortability. If they have access to the internet, send them a link to a how-to video. If they're just learning to accept, text messages on their phone, send the link that way. Just play to the level of their, their ability. And if they're not there yet, hey, just slowly bring them along. My mom's a perfect example. I actually left it up to my daughter to bring my mother up to the level that she's at now. She just started responding to text. And you and I know both know that text has been out for years. So, yeah.
That was a great question. Now, Dr. Dennis, I have a question from the audience to you. This is a good one. The guys in my house haven't had a haircut in 3 months. Can they get a haircut? What should they do to be safer?
Yes. In this particular region of the country, Tennessee, Middle Tennessee, and the whole state of Tennessee, we've entered the phase where haircuts are available now. As a matter of fact, my son got his hair cut just about 2 weeks ago, and there was social distancing. There were face masks being worn, and they were allowing no more than 5 parties in the barbershop at that particular time. If your particular part of the country is not at that phase, I highly suggest get those clippers out. I had clippers when I was in college.
Mm-hmm.
I had the kit, and I used to cut hair for my boys. I used to cut hair for myself. I did all the cutting myself, and I really did a pretty good job at it. So I think that if you're careful, I'm sure that you can actually get some things done. Just buy some clippers and get it done in your home. You may not look as normally are looking, but you can get it done.
Yeah, now's a good time to learn.
Hey, look, my thing is, look, you're not hanging out anyway, so I guess it's okay
Right.
if your haircut isn't that good. Now, I have another question for the audience. I'm going to throw this one to you, Greg, first. My question is about the balance of being responsible and social distancing while still trying to work. As an employer, how should I protect my staff and customers?
Mm-hmm.
I think that's a tough question because it depends on. The main thing in that is you want to keep your employee or yourself safe. You know, your employees or yourself safe in that situation, and even your patrons who are coming in, and you're going to take all the possible. You're going to take all the possible measures that you can to make sure and ensure that they're safe. But at some point, there's still going to be a question in there. You know, there are people who have been protecting themselves as best as possible who still contracted the virus. And that's a huge thing. I think you should follow the guidelines that the CDC has given out and other, you know, credible sources that are giving information on it. But just try to play it as best by ear as you can. And it's not going to be an easy task. You just got to kind of follow what you can do. And try to protect everybody because it's a battle of safety over business. And you want to keep everyone that you can safe, but some businesses have to continue to move on and keep going. Like at Matthew Walker, we never shut our doors. You know, we slowed down a little bit as far as how we were going about doing things and as far as like how we were letting patients into the building and seeing them, but we're definitely still, you know, been going the entire time.
And when we talk about people with customers, for example, and how can businesses protect their customers and their employees? One question I had was, have any of you gentlemen actually went out to eat since we're in phase 2 in Nashville yet? Have any of you went to any restaurants and sat down and ate, or are you all doing curbside to go still?
I'm not that comfortable yet. No.
I actually did for the first time like 2 days ago, and it was just me and one other person. The restaurant all the restaurants are still practicing the social distancing, so they're not at full capacity at all. I was actually like 3 tables away from the next person. I mean, from the next group of people. So it seems like it's getting a little bit more comfortable to be out. I'm still not going to be jumping straight into it at all, but it was just in that setting. They when the person I was going with, they were actually, you know, saying, hey, I looked up everything, all of their guidelines of what they're going by right now, and it seems like it's going to be okay. We're still practicing everything that we've been doing since all the pandemic started. So I think it's okay. And again, I don't feel like we should. I don't feel like we should be living in fear of it. I do believe that, you know, we should be taking it very, very seriously. But we can't allow it to control our lives and make us stay inside and have that much, you know, control over us. So I'm not saying definitely jump all the way out like that, but we should be able to get outside and enjoy some too.
And Doctor, that's some good points. Dr. Dennis, when you hear about phase 2 in Nashville and in the rest of Tennessee, I don't even think they have any, I don't think they even care anymore. I know, for example, I ate at a couple of restaurants here, and to Gregory's point, the places that I ate at was very social distancing. The whole staff, including management, had on masks, and it seemed they were very careful. I did go to Clarksville, where my parents live, and met someone out there, and I had to leave because there was no masks, and they were jam-packed, and that made me nervous about the rest of Tennessee. But is it possible for us to go out and enjoy a meal if the restaurant is being responsible, in your opinion, Dr. Dennis?
In my opinion, again, you have to be responsible for yourself, number one. Number two, be very aware of your surroundings, watching how they're cleaning, how they're wiping things down. Are they wearing a mask? Are they wearing gloves? Are the tables being properly spaced? I think that you have to really pay attention to how the restaurant is approaching protecting themselves and the patrons. If they are following those guidelines, I feel comfortable as long as you don't hear someone sneeze. If you hear somebody sneeze, get up out of there.
That's fair. That is fair.
That was fair. Yeah. If you hear somebody sneeze or one little cough,
That's it. It's over.
you know. Now, see, I think it's good too. We have to be able to laugh, I guess.
Yeah.
When we talk about mental health, with everything that's going on, what issues are we going to see, particularly in Black men, when we think about the death of George Floyd, the protests, and then the COVID? Actually, I want to kind of change that question around. When you look at the protests in America, and we see a rising steam with all races and all creeds and all religions, it's so many people behind this. Do you think that the fact that we have been quarantined for so long, and people have frustration just from that, had helped with this movement we see?
Yeah.
I would have to say yes. There's built up frustration from being at home, whether it be job loss, unemployment reimbursements or payments not coming, not knowing if those employers that you're working with are going to keep you on furlough, are they going to open up again, not having the finances that you normally have to do the things that you normally would do, builds anger, frustration, some depression. And then when you see these things happening in our communities, it can't do anything but affect the underlying undertones that are there already from the COVID by being in isolation and being part of this quarantine program. So I think, yes, it has an impact.
I can see that. And Roy, I think you're going to say something too. How do you feel about that?
Well, I totally agree with Dr. Dennis. The fact that people have been cooped up, pretty much shut down their social, mechanisms or their social networks physically. And now that they have a chance to get out, and this happening on the cusp of us getting out, yeah, it's like setting fire to a match. I mean, setting, gas on fire. It's like boom. So.
Yeah, I definitely think that, and also since so many people are not doing as much, it's like everyone's here for it right now. It's like, oh, I got the time to go have my voice be heard. Where normally there's so many things going on in your life, it can be kind of easy to ignore some injustices. But if you're just home doing nothing, it's like, oh, I got the energy for it. You're right. Right now, I got time. Now, I had two questions from the audience. I'm going to kind of combine them, and I'll let anyone that wants to grab it. One person asked, should we still be worried about COVID? Another person asked, what about a second wave? How do we recognize it? And when should we go back to shelter in place? So should we still be worried about COVID to the same level we have been? And is a second wave something that's definitely going to happen? And when it does, what do we do?
Well, I'm going to follow the science. I'm going to do exactly what my pastor says do. When the White House opens up, that's when I'll open it.
So you mean as far as like White House tours and things of that nature?
Yeah, exactly. When it start letting the public in, then I'll kind of let my guard down.
Yes.
Yeah. For me, like I think it's still just as vital to be protecting yourself as when it first started. Especially right now with all these protests and everything that are, that is happening and going on during the pandemic and everything that's surrounding it. I have been kind of paying attention to what's been going on, and I think it's actually a little, it's really a little bothering that I see so many businesses and stores that are closing down earlier now versus like during the protest and everything to protect their businesses versus doing it initially when the pandemic and everything first started. I think that gives a really bad kind of idea to put into, or a suggestion, saying that we care about you all's health, but we really don't want you to tear down our businesses, versus, during the pandemic started, everybody wanted to still keep their doors open to make money. And I think that that's a really bad thought to process as a human, as a Black man, because it seems like during the protest, when we're out protesting and, trying to be peaceful, everybody is wanting to the people that are out there protesting, be safe.
That from the science behind the virus, the science affects a different part of the body. This virus changes. And so the second wave may be that it's not causing as many respiratory problems, but could be causing problems with lung problems, with pulmonary emboli, blood clots in the body. It could be causing other types of illnesses in a second wave. So this virus does not stay the same. It changes constantly. And this is something that's very important to know about the coronavirus. That makes it different. So we have to be careful and take all types of precautions, because this virus is not going away any soon.
Thanks for sharing.
Definitely a lot of men, not trying to generalize, but they love to watch their sports. How do you feel that I heard the NBA is about to open back up? They're going to be playing in Florida. Is that something that's too soon, or is that good for our mental health to go back to those things that we find important?
I think it's going to be interesting. To what extent are they actually, how do you play basketball without being up on one another? I don't see that. So prior to them taking the court, I'm sure they're practicing to the best of they're following some guidelines to the max. Just
You have to think about the television stations, sponsors, advertisers, owners, and how much money is involved in the whole big scheme of things. Of course, the players themselves, they are employees, and they themselves would like to have their employee paid monies for services rendered, but it's bigger than the players. It's really about the broad scope of business. And so the decision to come back with sports in the way that they're coming back is about business, it's economics. There will be cases of the coronavirus that come out of contact. Yes, they will be. and they're stating that they will do whatever's necessary to protect those particular employees, which are the players. The big picture is the advertisers will still be there, the sponsors will still be there, and the owners still make their money. And that's what it's really all about. And that's just my opinion.
Exactly.
That look, that's the reality. What we're finding out during this process that business, money, properties is a lot more important than human life, it seems.
Yes.
Yes.
That's like when it comes to everything, that's the agenda I keep saying. Property, business, money is more important than human life. Especially like, do you remember a few politicians were like, if I gotta sacrifice my grandparents' life or my life for the economy, that's okay. It was just some ridiculous statement. Now I do have another studio audience question, and as we're down to our last 9 minutes, but I'm going to ask this question. This is a good one. Are the cloth masks that people are making really helpful? Are those masks that everyone was seeing, particularly on my Instagram timeline, should I buy one of those fake Gucci face masks? Cloth.
I hate to say this, hate to answer this question, but my wife has a one of those kind of masks. I think it's like a Louis Vuitton or something like a Louis mask. She loves her mask. And I tell her all the time, that's not an N95 mask. It's not protective. It's cute. It looks really, really nice. It's really fashionable, but it's not protective. So that's what I have to say about those masks.
I guess that was a good, you start off with the positive. It's cute. It looks nice, but so we should be getting the disposable masks that you can find like at Walgreens or things of that nature. The cloth masks do not work at all, or are they better than nothing?
I mean, it's something that's available. And if that's the only product that you have available, I highly suggest it. But again, it's not the protective things that we need in order to prevent us from catching the coronavirus itself. But I think that it makes us feel better. As a matter of fact, when those others are around you, they will feel better by the fact that you have a mask on your face. Regardless if it works or not, it just looks better to the community and the people around you that you are willing to do something necessary. If this is your only access point, there's a cloth mask, please wear it.
That's great. And I do want to ask this. I'm going to open this up to all three of you. As Black men, what stories, when it comes to both COVID-19 and the protests, the rallies, the death of George Floyd, do you feel that the media is actually missing? Is there anything that you would be able to say? You have members of the media right now participating in this, that you feel the media is missing, not stories they're not telling? Are they dropping the ball? Is there anything that you would want to say as Black men according to that?
If I could exclude anything, number 45 would not be reported on. Period. That would be my take.
Yeah, I feel like the media kind of preaches a lot of fear, and they put that out there for good reason. Well, not for good reason, but for reasons to, kind of control the masses. And it's not really good. As Black men, I think we have to, live in a different mindset. We have to take care of our mental, we have to take care of our physical, and look more towards our futures. And that means proper planning, building, progression, and mutual progression. And I know that that's easier said than done, but we have to continue. We have to begin and continue to work together. Outside of what we hear in the media, we have to go based on what is in our communities, and how we can affect there. So I do believe a lot of it is being misconstrued and put out there in ways that are supposed to kind of make to do those things.
Oh, that's great. Well, what we're going to do is we're winding down to the last 5 minutes. I wanted to give each of you a chance to give any final words about mental health, physical health when it comes to COVID, and the situation we are having in the nation right now. So we'll start with you, Dr. Dennis. Any last words?
My last words are that, again, the coronavirus itself is with us for a while, but there are vaccines that seem to be in production, and there's some positive outcomes so far as well with some antiviral medications on the market. It looks as though Remdesivir is actually being seen as a product that is very helpful in treatment of coronavirus. So there's some very, very positive outcomes as far as science and medication and vaccines that are right around the corner. So let's stay positive and stay hopeful. Also, too, I highly recommend that all of us that have children have that conversation with our children, that conversation. I think that if the media do or help and assist with putting together ways to have that conversation meaning how we approach some of the negative things that we're seeing as pertains to the deaths, untimely deaths of many that are out here. If children are seeing these images, we need to help them understand what they're seeing. And I believe that the media, if they can help with creating stories or documentaries to help them understand that conversation so that they're not walking around in fear.
Great, thank you. Roy?
Well, for my last words, I would like to put out there that, for the Black male, not necessarily think about yourself, but think about your loved ones, those close to you, your friends, and do the next right thing not to spread the virus. Wear a mask when you need to or when you're supposed to, and just stick to that until things get better. And I think everything will turn out all right.
Thank you so much. And
Complete society, we need to be a part of ourselves, and a part of our community first, and take care of ourselves as much as we can. And that happens through loving each other. I'm appreciative of the opportunity y'all let me come on here and talk. Thank you again, Jason. And that's about it.
oh, wow, thank you guys. This has been such a great opportunity to talk to three great brothers such as yourself. And we're gonna have some final words from our chapter president, Grover Murrell.
Okay, can you hear me? Okay, perfect.
Yes.
Sorry, we've had some technical difficulties today, but things happen, right? So anyway, so thanks so much for our panelists today. Thank you. Let's give them a round of applause. Thank you, thank you, thank you. This was a big topic that we needed to discuss. It's hitting all of our communities here in Nashville, but then also around the world and around the country. So mental health, I'll tell anyone, mental health is a big deal. It's important to make sure that you have the right mind whenever you're out, but then also to talk about mental health and be aware of mental health and how you can help yourself and help each other. I wanted to thank Matthew Walker for being a part of this. It's great to partner with them. We'll continue doing webinars and Zooms and Facebook Lives with Matthew Walker and our partnership with them. So I'm really thankful for that partnership. Again, thank you so much. I know we've got a couple of seconds here, but Founder Long, thank you for putting this together. Thank you for Jason, and then our technical folks in the background. Kanisha, that was running the ship. So thank you very much, and everyone else that's watching.